Well, of course, I guess nobody really likes to see the kind of caseload that has happened here in Fiji, especially over the last couple of days where the caseload has actually jumped up. We had 279 cases yesterday and 309 cases announced today. And I guess the implications of that here in Fiji are as they are anywhere else in the world. So strain on the health system. It means people have to stay at home, stay isolated for longer periods of time. And really, it's an effect on livelihoods as well, which is a big concern here in the Pacific and here in Fiji and across the Pacific.
Yes, and in all these Pacific nations, the biggest concern was spreading of this vaccine because the health systems are so vulnerable. How are the Fijians coping with this so far?
Yes, look, I mean, I think everybody's really doing their best, but you're right. By nature and by design, Pacific communities really are intergenerational. They're communal. People live closely together. They, they enjoy each other's company, very social communities. So, of course, it's very difficult when you have to go into lockdown conditions. It's very difficult to prevent the spread of the disease, especially when we've got the Delta variant here in Fiji. So that is why Red Cross is urging people to get vaccinated as, the absolute biggest tool that we have at our disposal to stop the spread of the disease.
But there are issues standing in the way of this vaccination rollout, and a lot of it is misinformation, mistrust of the system. How much is it a problem, and how critical is your role in trying to be a neutral player in this?
Yes, absolutely. Look, there are pockets of these issues for sure. Vaccine hesitancy is occurring. I think countries have done an amazing job, and our national societies for Red Cross are actually act as auxiliaries to government. So they play an important role in helping and supporting government to do the vaccine rollout, in reaching down at the community level to give targeted messages around community education, to encourage people to take a facts-based approach to understanding how the virus spreads, but understanding the importance of the vaccine as well. There's a large youth population across the Pacific, so there are pockets of places where social media has played a role in spreading misinformation, but there's also great youth leadership, which has taken on the role of encouraging people to use any platform that they have available to encourage vaccination. So yes, there are issues, but there are also places where they've done really well in vaccination rollout. In the Northern Pacific, there's huge uptake of vaccination. Places like Cook Islands are doing incredibly. But there are pockets where, for example, PNG, where things aren't going so well.
Yeah, well, let's talk about PNG for a moment, because, of course, the scepticism amongst the people in PNG is huge. Only about 16% of people trust that they should get vaccinated. And then you've got remote regions that are very difficult to access. PNG is such a vulnerable country.
Yes, I mean, you mentioned the importance of the neutrality role and the role that Red Cross plays in, counteracting some of this misinformation and hesitancy around vaccination. And that's really critical. We as an organisation, we have a large reach. We have an extensive branch network across the Pacific in PNG and elsewhere, and we have a trusted name. So when people hear about facts from Red Cross and the importance of vaccination, they do trust them. But there is, these social norms play a very, very tough role in sort of making sure that some people are still hesitant about that. And also, the logistical issues, particularly when you have to get vaccinated twice, when it's difficult to travel to places to be vaccinated, undertaking that trip twice can be difficult. So we are trying to, in some places, actually accompany people to vaccination sites. And we're playing a role there, registering people, comforting people, just speaking to people to allay their fears as well.
You've said that Fiji is a wake-up call for other Pacific nations. Do you think they are heeding that warning?
Yeah, look, I think it's a wake-up call for a few different reasons. They have time to prepare now. They have, in most places across the Pacific, a first wave has not happened. And so really they need to take this time now to prepare. their health systems, their people. Really, we need to have those targeted messages out there, and people do need to get vaccinated. So the vaccine works to save lives. We know that. We know that in places where people get vaccinated, of course, hospitalisation is not so high. There's less strain on health systems. And also, there's a complex context in the Pacific. It's not just, it's a place that's prone to natural disasters. The livelihoods have been hit hard. So, Red Cross is out there working again with governments to make sure that people are doing this preparation and pulling the biggest lever that they have to prevent the spread, which is getting vaccinated.
Yeah. Katie, great advice. Thanks for joining us.
Thanks so much, Bev.